Dr. Carla Brogna, Dr. Simone Cristoni, and their colleagues, they published this a few years ago. And the fact that this is not known, okay, like that not even 1% of the population understands this is really, really upsetting. This spike protein, depending on who you are, it can go into any cell. So it can impact all your different immune cells, your T cells, your B cells, your natural killer cells, your red blood cells, your white blood, like everything, your monocytes, so on and so forth. What we're trying to develop is an immune blueprint.
I'm Dr. Esra Çavuşoğlu, and I've been living a sober life for the past 18 years. My battle with addiction drove me to seek new methods, devices, and supplements to improve my physical and mental performance, enhance my quality of life, and ultimately live healthier for longer. From my experiences in addiction recovery, biohacking, and longevity to the latest global developments, from groundbreaking entrepreneurs to expert academics, the conversations I've had over the years are now featured weekly on Soberhead Podcast. Welcome to Soberhead, the podcast where we tackle today's biggest health topics with clear, fact-based discussions. In this episode, we're diving deep into COVID-19 and its lasting impact in our lives, health, and society. Joining me is Dr. Robin Rose, a board-certified specialist in gastroenterology and internal medicine, but more importantly, one of the leading experts on COVID-19 virus and its aftermath. We'll explore what long COVID really means, why spike proteins are making headlines, and the surprising rise in neurodegenerative diseases since the pandemic began. We'll also talk about how spike proteins might speed up aging and the concerns around sudden deaths potentially linked to microplaques. Ever wonder how COVID-19 could impact young brains? We've got that covered too. Plus, we'll share tips on spotting long COVID symptoms and steps towards solutions. Tune in and discover how the pandemic continues to shape our lives. Don't miss this crucial conversation. Our host for this episode is DotsUp, the space, community, and platform where creatives, experts, and entrepreneurs come together at the meeting point of continents, the Bosphorus. Follow the link in the show notes for more information about events and membership. I'd like to thank Gedik University and Gedik Foundation for their trust in Soberhead Podcast. With their support, it is possible for us to bring you this content at this quality for absolutely free. And of course, every single one who has subscribed to this channel. However, a huge amount of people who watch Soberhead frequently are not subscribed. So, I will ask you for a quick favor. Hit that subscribe button now, because when you subscribe, it helps us make the show better and provides better access to the world-leading experts. Subscribe and share if you like. And I promise to continue to bring you a better Soberhead every day. Dr. Robin Rose, welcome to Soberhead Podcast. This is a super important as well as exciting topic for the world, I shall say, not just for me or for parts of the audience, because exactly 5 years ago, actually, tomorrow, it was March 15th, I was in New York and everything got shut down. And that was day one of COVID I started experiencing in New York. Since then, the world changed. And I don't think there would be anyone can say, oh, I didn't get affected. I mean, people, even though didn't experience the illness, and you're going to say it more, the virus, because there are so many people saying like, oh, I didn't get it. But yet, you know, schools were shut down, businesses were shut down. There's a whole generation of young people couldn't experience social interactions. There's a whole generation of elderly that if they didn't die, they were isolated so much that their life shifted into immobile, dementia, it's like so many things. And also like world economy and everything. So this is a topic that should be interesting everyone. The reason I'm going to open the conversation like that, the reason is that you are in this group of doctors that analyzing not only COVID, but what you call it, the long COVID, as well as the after effect of the vaccine. It was really scary when I spoke with you and things that I'm experiencing around me. I'm scary meaning like I saw your face, but scary meaning that I thought long COVID was something that people had actual negative effects still going on, or it did go for, let's say, for the first 3 years. What I heard from you is that actually that's not it. There are still people that you consider that they're in this long COVID stretch. So with that said, welcome to the program. You're one of the leading experts about this topic, and you're spending all your time, based on my knowledge, about figuring out, unpuzzling, and treating people with that crazy virus that we're still talking about. So welcome.
Thank you. Thanks for having me, Ezra. I'm so excited to be here with you and to educate, your platform, be on your platform and educate your audience. So really excited.
Where shall we start? Maybe you just share how you got so interested into COVID, because you're a totally different area of expertise.
So I'll tell you the quick background. So I'm double boarded in internal medicine and gastroenterology. And a little bit prior to COVID, I really immersed myself in the functional integrative medicine space. And I got my certifications done within a year through the Institute of Functional Medicine. Right at the beginning of COVID, June of 2020, I gave my notice at my conventional gastroenterology practice, because I worked under the umbrella of a hospital system, that I was leaving and I was going to just open up my own longevity, clinic, integrative clinic. So I actually, in March of 2020, so I was following COVID in January because my husband at the time, he was doing a lot of work in China, and we had seen what was going on in China. He had a lot of, business colleagues and so on and so forth. So I knew it was coming, and so I was very intrigued already by what was going on and concerned, obviously. And then I had to take a business trip to Kentucky. And I remember it was March 3rd weekend, it was going March, and I knew it was imminent. It was about to come. And every, bone in my body was saying, should I not go? Should I go? And I was literally at LaGuardia Airport, with my face wrapped, 5 times with my scarf. And I wouldn't touch anything. I didn't go in the bathroom. I was just so scared of getting it. And then I remember I was there for a few days, and on the way home, there was this gentleman coughing like crazy in front of me the whole time, even though I was wrapped up and I didn't have a mask on or anything. And I'm I'm probably done. So 4 days later, I'm in my endoscopy suite doing my scopes, and I start sneezing like crazy. And I wound up going on to develop this really bad upper respiratory infection. I didn't have the pulmonary symptoms or the, desatting, but I was really sick, and I don't usually get sick, and I was pretty sick, and I couldn't kick it. And I was also really afraid that I had COVID, and I was oh my God, I'm going to die. In my head, I was so scared of it, just because of how, what we knew about it or what we didn't really know about it from China. So I wasn't allowed to go back to work, because while I was sick is when everything started to get shut down, at least here, where I was up, I'm right outside of New York City. I started just becoming obsessed with COVID, obsessed. And I literally attended every webinar around the world given by every world-renowned virologist, anyone that I can find to understand how this virus worked, how it attaches to the receptors, how that furin cleavage site works, and why it's so much more dangerous than prior SARS-CoV infections and so on and so forth, or coronavirus infections. And I literally studied and searched the literature, and I wrote a primer, and no one knew me at the time. So I wrote this primer that I put on my Train Health website that basically went through every single natural compound, polyphenolic compounds that work synergistically to basically help protect you from the virus. Anything that the receptor binding domain, which is where the virus attaches so it could get inside the cell, how to block that, how to block, that furin cleavage site that separates the S1 from the S2 so that the virus can become active and do damage, and so on and so forth. All of those things, could be taken care of by all these natural compounds and molecules. And I literally would be up until 2 a.m. At my dining room table, studying, researching. I must have read well over 200 papers. And I wrote this, and I just started trying to get my family and friends and people I knew to start taking these compounds to sort of like build immune resilience and protect themselves like from the virus.
You know that on Soberhead podcast, I do not recommend any product or protocol I did not personally try. One of the best tools I've found is Prolon's 5-day fasting mimicking diet. It's not just another weight loss kit. It's designed to help reboot your body's own renewal processes. I've noticed that after a 5-day FMD, I feel sharper, lighter, and more energized. You can listen to the detailed interview I did with Walter Longo and learn about fasting mimicking diet. So if you want to give Prolon a try and experience it yourself, use Ayık Kafa 15 code to get 15% discount on your initial order.
So that's how it all started. That's how it started.
Yeah, so let me paraphrase what you just shared. So you kind of looked to the mechanism and action of the virus, and you were trying at your best shot, trying to stop virus being so damaging into the system.
Correct.
Yeah. In simple words.
And then, 2020 is going along. I finally left my conventional GI practice and I opened up Terrain Health. We were doing telehealth for a while, and then we were in an actual space by November, December of 2020. Now, I was seeing, when I see patients, I do, a very deep dive into all their organ systems, and I do, a large amount of blood work, not like what you typically get when you go for your physical. And I also, because I was very immersed in the gut microbiome space, and I really was more of a gut microbiome specialist, for a while prior to the COVID thing. I mean, I still am, but I was doing next generation sequencing of the gut microbiome on everybody. So what I started to see moving into the beginning of 2021, I started to see a lot of abnormalities on the blood work that I've never seen before. And remember, as a gastroenterologist, like I was seeing thousands of patients a year, and I would do blood work on hundreds of thousands of people. So I'm used to patterns and seeing what blood work looks like or how often it should be abnormal. And I just started seeing everyone coming in with like very low white counts, very low neutrophil counts. Like I would see maybe 5 people out of all those people I just said a year that might have like a low white count or fall outside the bell curve of a white count, like not to this degree in every person, right? And then I started checking D-dimers, and D-dimers were abnormal on people. And then I was noticing there was a weird pattern in their iron, studies. And there was just like all these bizarre things. And then on the sequencing of the gut microbiome, I noticed that nobody had bifidobacteria anymore, which is one of your most important species, especially when you're talking about the innate immune response. That's your first defense, right? When you're trying to fight off an infection. So I was like super perplexed, concerned. And then I started talking to other doctors that were like-minded and seeing what I was seeing, right? And at the same time, especially when the vaccines rolled out, I get all these feeds, these medical feeds, right? And I would start reading articles that really intrigued me that, came out from, let's say, this very well-known PhD or scientist from Canada or someone from Europe. And it would be talking about that there were concerns about this mRNA platform and what it could be doing to our cells and the side effects that we might be seeing. And it would be gone within 24 hours. It was censored. Like I wouldn't be able to share the article or send it to anyone. So that really piqued my curiosity, and also the patterns and the abnormalities that I was seeing on the blood work in many of these patients.
I think that people who are known in the media, they were not allowed to speak about take vitamin D or whatever type of an immune support. So that you're talking about not only the researchers were disappearing or findings were disappearing from online platforms, also people were not allowed to to speak about other things. Let me ask you, people that you were seeing this pattern were changing, were people who had already COVID, or people who are actually at that very moment are having the COVID? Because D-dimer, I remember there was this blood marker, the D-dimer, that when we had COVID, they were measuring that.
So I was seeing abnormalities in people that never had COVID but were vaccinated, and people that had COVID that weren't vaccinated. I would see patterns that looked similar in both population sets. Remember, early on, you had cleaner cohorts of people. Like now we're a hybrid population where the vast majority of people, or even like a year or two in, had gotten the virus and vaccinated. At that time, early on, even going through like at least half of 2021, a lot of people hadn't had COVID yet, right? And then they got vaccinated, or you had people that just had COVID and not vaccinated, or vice versa. Researchers that were doing studies at that time that were able to distinguish, pretty cleanly between those two population groups, that data was very important to look at too, to understand what was going on.
Regarding the vaccines, there were, like in Turkey, even though I was in America, I knew the first vaccine that people had was a regular vaccine coming from China, actually. It doesn't matter where it's coming from.
But it didn't use the mRNA.
Exactly. Platform. I think Johnson & Johnson also didn't have the mRNA.
It doesn't, but it still instructs your body to make the spike protein.
Okay. All right.
So the adenovirus vector, that's what it uses, but it's not the same thing, but it does instructing the body to do something similar. Yeah.
All right. Then you started seeing all these abnormalities and you guys started chatting with these doctors who are experiencing similar things with the vaccine and with COVID patients.
And then it was interesting because one of my really, really dear colleagues, Dr. Suzanne Gaza, she's a brilliant, integrative neurologist. There were some other people that were cardiologists. It was interesting to be collaborating with the different specialists because they also, just like me, when I look at certain, biomarkers, they look at different biomarkers than me. And together we were able to say like, oh my God, prior to the pandemic, we never saw these biomarkers go up like this at this rate or in this many people. And so then we were collectively able to start figuring out different biomarkers to start looking at, right? And look at these patterns that we started seeing in all the patients, right, that were coming through our door, because we would start checking everybody because, as a longevity doctor, you're trying to be proactive, right? You're trying to avert the crisis. So we were trying to catch people, right, early and, reverse these things. Do you understand what I'm saying?
Yeah.
So it was really helpful, collaborating with people with all different, medical backgrounds and scientists so that we could figure out, how we should be looking at these people and then treating them.
Then, everything passed. People are back to life. But it seems like there's a huge health crisis is happening. Just for me in Turkey, for the last 2 months, I heard 4 deaths and multiple strokes.
Yeah.
And out of nowhere. And they analyzed, they looked to everything, and just like these are healthy people in their early 60s, strangely enough, 58 to 62, the ones that I see. Either they're dropped dead right away on the street like that, or they had a stroke. They just feel the paralyzing maybe an hour or two of their legs, arms, and then it goes away.
Yeah.
And then they do a thorough investigation and they cannot find nothing.
Right. So probably what's driving a lot of this are the microclots, the vascular complications from the spike protein. So the spike protein is really what drives the pathophysiology, or what we're seeing with these bizarre presentations and conditions, and also a combination of people being vaccinated and then getting the virus because you're immune priming that person too. So then you have all these weird, very, very bizarre, rare autoimmune phenomenons occurring where you don't recognize it and you do the full workup and you don't understand what this is, because it's, again, being driven by the spike protein. Everyone always thinks, the ACE2 receptor, but it's not. The ACE2 receptor is one little drop in the bucket. The spike protein can attach to we've identified well over 24 different host cell receptors in our body. So that's why the virus itself, or the spike protein, is such a beast, right? Because it can impact or affect any organ system in our body because it can attach to all these different receptors and gain access to the cell. So that's first of all, and that's because of the gain of function done on the spike protein, because that furin cleavage site, there's gain of function on that. So that cleavage site is much more enhanced than prior coronavirus or SARS-CoV infections, okay? And so it makes it much more virulent and much more accessible to our cells. So that's why it's so different than other viruses or diseases that we've ever seen. That's one of the main reasons. So the point is the spike protein, especially lives inside the endothelial cells, which are the cells that line your blood vessels, right? What happens is it causes this low-grade endotheliitis, this inflammation of the blood vessel wall. And when that happens, platelets get activated, and then the platelets release all these different bad players, these bad cells called inflammatory cytokines, and then different chemokines that attract these other cells to the area that just promote inflammation. And just this vicious cycle of inflammation. And then also the clotting cascade gets activated, okay? And these clots, or when fibrin comes into contact too with the spike protein, it makes these clots amyloidogenic. They're resistant to the regular normal mechanisms that our bodies are used to breaking down clots, right? So that process is called fibrinolysis, and it's resistant to that. So these little rubbery microclots that are amyloid, beta amyloid-like, or they are beta amyloid, they don't break down. So it's not like everyone's presenting to the hospital with a pulmonary embolism, a clot, a macro clot, like a big clot in their chest, or a DVT, a big clot behind your leg, But these microclots can start jamming up the microcirculation, right? So your little, your small vessels, your capillaries that feed all your cells, organ, and tissues, it's completely, they're jammed up. And so that's why people feel so awful, right? They feel like they're underwater. They have so much head pressure. They're so exhausted, the chronic fatigue, the post-exertional malaise, and then all those other things that come with it, and organ damage, damage to the heart muscle, the kidneys, the brain, all these other things. That's one of the pieces of the puzzle. That's one of the things driving this for sure, right? I mean, there's so many layers to it. But that's probably why when these people get, these transient episodes where, their right side of the body went numb, or they lost feeling in their legs and they couldn't walk, or they just go under a stroke, they have probably these microclots. We have evidence that they start to form. They almost look wormy looking, and we call it my mentor and research partner, Joachim Gerlach, he calls them calamari clots, and they're rubbery calamari clots. And this is what's probably why people are presenting the way they present and why they can't pick up. They're not seeing what's driving it.
You said that when this virus gets into your system, or it seems like the vaccine is kind of the same, whether you get the COVID or
the vaccine, remember, it's the spike protein that they used, right? Yeah. In the vaccine, which is the most virulent part of the virus, right? And then because of the platform they use, and because it's instructing your body to make more spike depending on, that person's, right, genetic makeup. Everyone's different, right? And if the mRNA got inside a cell, and then once the mRNA is inside the cell, it will continue to instruct the cell to make spike protein.
So hold on, that's like a horror movie. So basically, I personally had 3.5 Moderna. So each time I had these vaccines, I get more spike protein in my system.
Maybe. It depends. I think everyone's different. I think it depends on the load that you got. I don't think all the vaccines were made the same necessarily. I think some lots had maybe less, some had more. There was different excipients in it, so on and so forth. So it depends, right? And it depends, again, genetically and epigenetically, right? What were you set up for, right? Everyone's so different. So I think the behavior that I'm explaining is different in different people. And that's why some people are so sick and some people are like, nothing happened to me, right? But maybe symptomatically they haven't presented, but then it begs the question, is it smoldering in people, right? Why, perhaps somebody, you see all these athletes, right, that have drop on the basketball court or the soccer field, in Europe, there was it was up 1,000%, after the vaccines came out, then all the years prior, you know, they looked, I think, from 1990s up to 2020. And the amount of cardiac arrest that we were seeing and incidences like vascular incidences and things like that were so high. But why is that? Because if the spike is smoldering inside the blood vessel wall or inside, you know, the cardiac cell, wherever, and you have even a smoldering myocarditis, right, or inflammation, maybe you're walking around with it for a really, really long time, and then something happens where, like, it just tips the scale, and then, you know, that event happens, right? There's, you know, this is all, like, being teased out, but we know there's tons of research to support that the spike protein is living inside the cells, okay, for months, if not years. And that could be both the spike protein from the vaccine or the spike protein from the virus.
Probably 90% of the world now so far got COVID. So most of us has probably left over a couple of here and there spike protein left. When you said that, you know, it attacks to whichever organs, like how does these spikes picking their path, like based on what?
I don't know. I think everyone has their own unique blueprint or fingerprint, right? And I think it goes back to like epigenetics, like how well does somebody detoxify, right? And get rid of things. It's funny, like, and this sounds like sort of simple, but I feel like it almost like finds that person's weak spot and that's where it goes, right? And again, this epigenetic part, like how we interact and adapt to the world around us and like what our epigenetic expression is and where we are at whatever point in our life, right? Based on like all the different things, like how we sleep, how we eat, how we move, the toxins or the exposome that we're exposed to on a daily basis, like that also sets us up for being more susceptible to this biotoxin, right? I mean, we already live in a toxic soup. We're exposed to all these things. And then this was just a really, really powerful biotoxin that I think pushed a lot of people like they were here and it just like pushed them over.
The other day when we spoke, the way that you explained sounded to me like an autoimmune disorder. Like wherever you're weak, it kind of goes there in a way.
In a way, yeah. And the patients at this point that have been walking around with this like for 3, 4, 5 years that are so ill, it is like a full-blown autoimmune disease. It really is. I mean, the spike protein causes what's called molecular mimicry. These autoantibodies are forming, you know, all over our body, you know, and depending on what organ or what part of our body it's mimicking or imitating will also impact how that person presents and what their symptoms are.
Before coming to this recording, I always do a little research, listen to people's podcasts and stuff. And I heard that there is an elevated rate of cancer, dementia, problems with kids, probably brain, I heard.
Yeah, neuropsychiatric.
Yeah, and so many more. Let's start with the brain. So what happens to the brain? Okay,
so you have your blood-brain barrier, right? It's lined by these cells called your astrocytes. And then they're wrapped in, on the other side, there's your pericytes. And the spike protein has a very high affinity for like both of those cells, okay? So when you look at postmortem studies or look at these, you know, brains under immunofluorescent microscopy, they're lighting up with spike protein. In one of my presentations, I have a few slides that shows early on, you know, this really well-known pathologist from Germany was looking at postmortem studies, and they also looked at they had a mouse model also, and they basically showed that the spike protein like gets taken up everywhere, but has a very high affinity in the brain and these cells, and also in the postmortem studies, 60% of the people that they had to look at postmortem that had COVID, 60% of people that had COVID had the spike protein embedded in their skull, in their skull bone marrow and their meninges and the skull meninges connection, like that's how it gets from it leaves the meninges and gets into the actual skull. So this has all been proven, and we know that this happens. So what happens is these astrocytes, which are you know, you have to have a really tight knit blood-brain barrier. That blood-brain barrier is very, very selective. We don't like a lot of things to get across our blood-brain barrier, right? That's on purpose. And so now what happens is because the astrocytes and the pericytes are infested with spike protein, the blood-brain barrier starts to fall apart, right? And so now you have all this stuff flying across the blood-brain barrier, okay? On the other side, I just say like whatever of your brain is what's called your glymphatic system. Just like your lymphatic system gets rid of all the garbage in your body, the glymphatic system was what drains your brain of all the garbage. Okay. The glymphatic system is lined by astrocytes and these aquaporin 4 channels. And those also get affected by the spike protein. So what happens is now you don't have this like peristaltic or whatever you want to call it motion of like moving things out of the brain. That's destroyed. So it's almost like your head's like a pressure cooker. Like everything's flying across the blood-brain barrier and now nothing's getting out. Okay. And then this drives inflammation, vascular inflammation where you have like a vascular dementia. Then you get into full-blown neuroinflammation. Your microglia cells, which are not good, get activated. And then that starts throwing off all these other inflammatory cytokines and so on and so forth. And then you move on to full-blown neurodegenerative disease. So we will be seeing we are already and will continue to see a tsunami of neurodegenerative disease like we've never seen before. And we, even like a few years ago, even 3 or 4 years ago, if you talk to my colleagues who are neurologists, they were seeing ALS like they've never seen before. They normally would see an ALS patient 3 times a year. They were seeing them 3 times a month.
I hear also MS a lot.
Well, MS gets reactivated, or MS that's in remission has been reactivated. Parkinson's, actually, I have a slide that shows this. Between 2020 and 2022, Parkinson's has increased by 50%.
Wow. 50,
not 5, not 10, 50. Okay. The rate of dementia, like there was this Australian study and it showed like adults, like men and women that are taking or prescribed pills for dementia or Alzheimer's dementia has been exponentially rising since 2021. So these are things that we're seeing on a daily basis. Now, I screen many of my patients for these markers that look at beta amyloid, tau, fibers, and things like that. The other piece that's a little complicated, but I'll explain this because it's really important to understand that's driving this neurodegeneration is really important, is these things called the hammerstrom fibers. And so let me explain them. These 2 amazing researchers, incredibly brilliant researchers from Sweden, I'm sorry if I misspoke, but Per Hammarström and Sophie Nystrom, okay? They basically discovered what's called the hammerstrom fibers. So when you get infected with SARS-CoV-2, your neutrophils, white blood cells, get activated. And there's a massive activation of your neutrophils. And the neutrophils release this enzyme called neutrophil elastase. Okay? Neutrophil elastase, when it attaches to the spike protein, when it binds the spike protein, depending on where it binds, it will expose certain amino acid sequences or these epitopes, okay? Because it starts to break the spike protein apart, okay? So depending on where it starts to cut the spike protein, whatever amino acid sequence is exposed can turn into these neurotoxic fibrils, okay? So you can see it in a petri dish, like on contact with the spike protein and neutrophil elastase, depending on where it's cleaved or broken, you can get the production of all these different neurotoxic fibers. So like alpha-synuclein, which is a precursor to Parkinson's disease, the different tau proteins, right, which is Alzheimer's dementia, the beta amyloid production, which is also dementia, Alzheimer's. Then they overlap between some of the other neurodegenerative diseases. There's another epitope for ALS. And then even one of them, the 525 epitope is what they call it. Like there's a few papers that they wrote on this. That's prionergic, meaning prion disease.
What is that?
Mad cow's disease.
Okay, mad cow's disease.
So my research group, or the group I work with in Europe, they're working on this right now in hamster models where they're trying to see if this is really a thing. If the prions are really an issue, you're going to start seeing a lot of people presenting in the next few years. It's a little more indolent and takes time to present. But, we're seeing, very rapid onset dementia, like out of nowhere. And, some of these people are old, but they were completely fine and coherent and lucid. And now they've declined very quickly. We're seeing even young people with Parkinson's, Alzheimer's, dementia. I will say a lot of these biomarkers that I'm looking at, I'm screening in my younger patient population, and it's positive. And so as a community, integrative, functional, longevity doctors, we have to come together because we're really the best physicians to take care of these people and really start acting proactively so that we prevent the things that you're seeing in your friends.
So now that you explained the brain, so basically what you're saying is that these spike proteins make the protective part of the brain weaker. Therefore, the regular toxins, inflammation, whatnot is getting in the brain and is causing it. So it's kind of making it weaker. I heard in one of your conversations that it's kind of doing the same thing to the gut.
Oh, yeah. So let's go there.
Yeah, let's go there.
There's two other points. Let's go to the gut, and then I want to explain one other thing, which is really interesting. We sort of touched on it, but I'll go into detail so you have an understanding. Yeah. So this is very important to understand. So I think of the gut as ground zero, right? So we're talking about the spike, but let's talk about the virus itself, right? So Dr. Carlo Brogna, Dr. Simone Cristoni, and their colleagues, they published this a few years ago. And the fact that this is not known, okay, like that not even 1% of the population understands this is really, really upsetting, okay? The virus is a bacteriophage. So what does that mean? The virus invades the bacteria in the gut, okay? So when you look under an electron microscope, right, you'll see this circle, which is the bacteria. And inside the bacteria are all these other little tiny circles, which is SARS-CoV-2 multiplying. So the bacteria is teeming with SARS-CoV-2. So the virus is taking over, the DNA of the bacteria and starts doing its own thing, right? And once you have these phages, they start releasing these toxin-like peptides. That's what the researchers coined it, okay? And these toxin-like peptides can impact any organ in the body. And a lot of them are even neurotoxins, and they cross the blood-brain barrier. And, basically these toxins can impact your heart, all different things. So now this is another layer, right? And more fuel to the fire that I'm talking about. Now, these phages can live in the gut for months, if not years, right? So we need to get rid of the phages because you're walking around basically with replicating virus, and this virus is then spitting out more spike protein.
Because it's replicating because these bacteria are replicating.
Right. So you have to kill the bacteria. And so now most people's gut microbiomes have been really negatively impacted and or destroyed. And I cringe when I say this as a gut microbiome specialist, but I hate giving antibiotics. But Brogna and Cristoni, they basically prove that using specific antibiotics kills these phages. And the thing is, you're worried about the gut microbiome, but it's not functioning. It's doing all bad stuff because it's invaded with these phages. So you have to really almost decimate the gut microbiome and then rebuild it. What's interesting is that these toxin-like peptides, they've identified about 300 to 400 different ones, but most people overlap with about 10 to 20, where it's very common that they have these 10 to 20, and then you'll have outlier ones that maybe you have one that I don't have, so on and so forth. But what we're researching is trying to develop these blueprints that each person has their own pattern or their own unique sort of blueprint of these toxin-like peptides, and then you can figure out what that person has and back into it and try to personalize their treatment. That's a really important part of understanding how this virus or how the spike protein behaves, because they also have identified that the spike protein from the vaccine also can be inside these bacteria and also throw off these toxin-like peptides.
So is it also loosen up a bit the tight junctions and get into the system through the gut as well?
Phages and these toxin-like peptides destroy the intestinal mucosal barrier. They destroy it. And and then you have leakage of lipopolysaccharide, LPS, SPPLA2, all these bad players that are also adding more fuel to the fire. It's just, there's so many layers to this. It's, like I said, it's such a beast.
It is a beast.
It really is.
Yeah, it is. It's really crazy. You said that there was one thing that we jumped into the gut.
I want to explain this. So this is really important. SARS-CoV-2, or the spike protein, is an age accelerant, okay? Because it drives senescence. Once the spike protein or the virus is inside a cell, that cell is rendered senescent. It's a senescent cell. So we, in the anti-aging space, we talk about senescence all the time, right? Because we're trying to like avoid it, prevent it, reverse it, so on and so forth, right? Because that's why we age. That's why we wrinkle. That's why we're more prone to infection and inflammation and all those things, right? So once it's in the cell, it's senescent. And what the spike does is it basically disables through the production of certain proteins that inhibit autophagy.
Oh.
And autophagy is what saves the cell. So the cell can't be saved once the spike or the virus is inside it. So now you have all these zombie half-dead cells, right, living inside of us, throwing off all of these inflammatory cytokines. And then what happens is they start to actually coalesce and they form this grouping of what's called syncytia cells. Syncytia are like all of these senescent cells sort of glob together. You can see it also under a fluorescent microscope. It's insane. There's even a study showing within like minutes of being exposed to SARS-CoV-2 that these syncytium form within minutes. And so now you have these big syncytia floating around wherever in your body. You know, who knows how much someone has, where they are, and certain people, you know, so on and so forth. And they're then throwing like inside the syncytium are like, you know, toxins and old spike protein and pro-inflammatory cytokines. And the inside of our body is like a disaster area. So what I want to make the point is that you can have productive cells and you can have depot cells. Let's say you had a vaccine, the spike protein got inside the cell, right? Then, okay, that cell is definitely a senescent cell, but it's not a productive cell. It's a depot cell because it can't replicate without anything helping it replicate. If the spike protein from the vaccine and the mRNA got inside the cell, then that cell is a productive cell and can keep making spike protein. Oh, and we know that this
like
can
cancer
happen.
Cell.
Yeah.
Because they're kind of multiplying.
Well, it's just making and spewing out spike. Yeah. And then that spike finds another cell, and then it makes another cell senescent, and it's just like a vicious cycle. And then from the virus, it's the same thing. So the virus is shedding and making trillions of spike protein for each given infection, right? And so if the spike protein attaches to a cell, because that's all it wants to do. The spike protein is a magnet for any cell a healthy cell comes into. It doesn't want to live in your bloodstream. It doesn't live there. It wants to be in the cell doing all this damage. So once that spike protein from the virus gets inside the cell, then that's a senescent cell, but it's not productive, but it's still doing bad things. And then if the virus is in the cell, then that's also a productive cell. So you have these productive cells either from the vaccine if the mRNA gets in it and from the virus if the virus is in it. Now, the senescent cells that have the spike or the virus or so on inside of it, they then can communicate with adjacent cells through I'm not going to get into it because people are going to be like, what is that? But it's called SAS. It's fine. And they basically can make those cells senescent. But the cool thing about that is that if you have these neighboring cells that became senescent because of this communication system, sort of like, you know, making these other cells senescent, they can be recovered because they don't actually have the spike protein in it. And so those can be recovered by using certain compounds, and we can get into that after, and recover them because they still can use autophagy to get better, you know, to repair themselves. So you have just like so many different things going on and so many things, but the bottom line is no matter what, right? Like I just read this paper that came out recently, these researchers from Gladstone Institute, and, you know, they were talking about fibrin and how it's the fibrin that is one of the major players and how the fibrin interacts with the spike protein and how that's driving a lot of these. Sure. But if you think about root cause in every single one of these instances, it's the spike protein. You have to remove the spike protein. And we have to have treatments and preventative strategies in place to prevent us from getting the virus over and over again. And if we do get infected with the virus, we want to squash that viral load right away so we don't have shedding of the spike protein. And, we want to have really good treatment strategies in place. So it's all about prevention so people don't keep going on to long COVID.
Robin, but the way that you explained, it seems like, most of us may have, whether we feel or not, it's like everything you explain is like having a long COVID because these spikes are in you or the virus is in you and keep multiplying or damaging areas and stuff. Have you guys ever saw anything like that? Because obviously you're an MD, you're a scientist. I'm listening to you and I'm like, wow, what a sci-fi movie that, it's just like these bees start eating everything.
So what would be nice really is, I'm lucky enough that I'm doing R&D and we're, using, really expensive laboratory equipment to actually identify spike protein, and we can differentiate spike protein from the virus versus the vaccine. And we can also understand what each person's immune blueprint is also. So now that we talked about what the spike does and how it gets inside, remember, once it's inside, you have the senescent state. So this spike protein, depending on who you are or how it presents in you, it can go into any cell. So it can impact all your different immune cells, your T cells, your B cells, your natural killer cells, your red blood cells, your white blood, like everything, your monocytes, so on and so forth. And so what we're trying to develop is an immune blueprint so that we can see where the spike protein is living, like which cells it's inside in you versus me, right? And I will tell you, all people do look different. Some people look similar, but everyone has their own sort of immune blueprint. And, understanding that is going to be really helpful in trying to prevent these cancers moving forward and these immune deficient states. People, I'm sure you've seen it too, people get sick way more often than they ever did. And they'll even have one or two or three viruses at one time. And then it takes them a lot longer to kick it. It's because we are more immune deficient because the spike protein does live inside these cells and you get a qualitative deficiency, not necessarily quantitative. You might not see it on the blood work, but qualitatively in a lot of people, these immune cells aren't working optimally anymore.
If you want to put in percentage among all your colleagues, how many of the people that had COVID or vaccine are experiencing any one of these? And if there are any people that, this person had, let's say, multiple COVID or vaccines, but they're super clean?
I will say that even people walking through my door for longevity or health optimization have abnormalities on their blood work, right? I would say there's a specific pattern to the blood work, and with looking at certain biomarkers that are elevated that sort of say, we need to worry about this person. And then some people that don't, right? I don't know a percentage. I will tell you this though, on the last batch of our last cohort, of patients, I ran some controls or even my own staff that are seemingly healthy and don't have issues, and they're young. And they have spike protein inside their CD4 cells and their CD8 cells, right? One of them have the toxin-like peptides circulating in their system. So, until we get to the point where we're testing, where we can more mass test, I don't have an idea. But if I was to guess, I would say easily over 50% of the population is walking around with one or the other.
Yeah. Just before we started this conversation, you said that there was a new study that got released about children who had COVID but without symptoms.
I'll talk to you about that. Yeah. So what's really frightening, right, but interesting, and I think we should be really paying attention to this. In the last year and a half, there's been three really great publications, a handful of publications that have come out around, neuro COVID and, the neurological findings. And even patients or people that are young, like meaning like college age in their 20s, one study showed that young people that had even just one exposure to the virus, right, that were either mild or even asymptomatic, had changes to their brain. They had changes in their gray matter, in their white matter. That's a big deal, right? Then there's been at least 2 or more studies showing that patients or young people too with very mild COVID case or asymptomatic have decreased cerebral blood flow. So blood flow to the brain is impacted and goes down. Then there's another study that shows, patients that had COVID but didn't go on to long COVID have long COVID, and then you're like control, like that didn't have COVID. And it's insane. Like even the patients that had COVID but have no symptoms or anything, they have a very significant increase in cognitive impairment. Not nearly as high as the long COVID cohort, but they do, right? And there was even in one last one, there was even a study with medical students, and they did cognitive testing on them, and their cognition was impaired unbeknownst to them. So this is something we have to start thinking about. I think that in the next few years, when hopefully people get their heads around this more and are listening, that a lot of our screenings are going to have to move up, like, screenings for cancers. We're just going to have to be doing things like a little differently so that we can be proactive. Because the thing is, Ezra, is this virus isn't going anywhere. Sure, depending on, the advice of your doctor and what your risk is, if you don't need to get the vaccine anymore, right? That takes away maybe one inciting factor. But the virus goes nowhere, and people are now getting infected 2 or 3 times a year because each mutation, the newer mutants, especially the Omicrons, they're much more transmissible and infectious, right? They're not as pathogenic, right? Meaning you're not in the hospital, you don't have to worry that you're going to die. But at a cellular level and what it's doing to us is very concerning. It's almost like a silent killer in a way. And again, layering that on top of all the other stuff that we deal with on a daily basis and all the other toxins, it's very problematic.
Now that we scared the shit out of people.
Which I don't mean to. I just think knowledge is power.
They need to, in my opinion, they need to, because it is what it is. What happened, happened. But I'm prone early screening, without getting sick, early screening.
Right,
what I'm hearing from you is that now it's the time that put the boots on the ground and say, like, you know what, don't wait until you're sick. You have to keep checking on your system. So what are the things that you are doing at your clinic and with people around you? Because you guys are a small group of doctors, I guess.
The guys I work with in Europe, back in January 2020, they patented their own formulation of this like polyphenol compound, which I love and I use a lot as like a backbone to my treatment. It's called Medicinals 9. It has 9 polyphenol compounds. And what they did was they looked at all the 250 plus pathways that SARS-CoV-2 impacts. And then they were able to back into it, understanding that these polyphenol compounds all work synergistically together, right, on all these different pathways, right, to block the virus from doing bad things, if that makes sense.
Yeah.
Here's the thing, Ezra, like I read article after article, like this is in phase 1 trial, this is in phase 2 trial. There's no one panacea. You have to come at this from all different angles. And targeted pharmaceutical drug therapy is not going to help this disease at all, because there's and I didn't even get into half of it with you, like there's so many layers and so many things that it does and so many things you have to worry about, right, systemically. So you need to attack it from all different angles. And these polyphenolic compounds, our body knows how to use, we've evolved with them, and they work on all these different pathways and receptors and enzymes and so on and so forth. So using them is not only like safer, much safer than, using drugs, but using it the right way at the right dose.
Is it like a preventative or after having COVID?
So we use it for acute treatment, in long COVID treatment, and also preventatively, prophylactically. So The medicinals 9 is great because many of the compounds in there are both binders, like they can bind the spike protein, they're gentle binders. They're senolytics, meaning they will break up these senescent cells. They are senomorphics, meaning they'll take the cells that are senescent without the spike protein in them and help them morph back into a healthier cell. They are receptor binding domain blockers, meaning they'll sit on the receptor to block the virus and the spike protein from attaching and getting into the cell. And they also inhibit the furin cleavage site. So they inhibit that splitting of the spike into S1 and S2. But then they do a million other things. I'm just giving you. So that's why it's a good, base sort of like fennel product. And it's really great because a lot of those compounds are great for your gut. They're great for immune resilience. They're great for general inflammation, joint pain, I can name all the things. So anyway, that, and then, well, if we're talking like treatment, right, that, and then, I use in the studies that Carla Brogna brought up, Cristoni put out for the phages, because the phages are going to form right away when you're, exposed to the virus. We use amoxicillin for a week.
Is that an antibiotic?
Yeah, or if you're penicillin allergic, we use azithromycin. And you can use it with or without Xifaxan, plus the medicinals 9. And then we also have on board binders, this product that they made called sequestrol, which bind it. And then they also have a senolytic product, because as you're actively infected, because some cells will start to become senescent, because I showed you within like minutes it can happen. So you have the senescent, you have the senolytics on board, the binders on board, the medicinals 9, which has all the things. Because remember too, when you're breaking up cells that the spike gets into, after you break that cell apart, that spike wants to go somewhere else. So you have to have products on board that are blocking the receptors, right? So that new cell, that new healthy cell, doesn't get infected with that spike. So it's very complicated. And then in the long COVID patients, and then you're using a bunch of other things, like people, we use peptides, we use this, we use that. So that's like more treatment. Going backwards to preventative, povidone iodine when you're traveling is great. Like we know that has 99% effectiveness against SARS-CoV-2, other coronaviruses, common colds, RNA viruses like flu, things like that. But again, iodine, too much of it, you have to be careful because you don't want it to start impacting your thyroid, things like that. The guys that I collaborate in Europe, you can get it. There's a nasal spray. It's a medicinals 9 nasal spray. It's fantastic. And all the different compounds that are in that, it was built to sort of block the virus from attaching to the receptors in the nasal mucosa to gain access to your body. Because remember, whenever you're exposed to any virus or bacterial infection, it's gaining access through the oropharynx, right? You're breathing, you're breathing it in through your nose or here. So it's designed to help you with that. And, hopefully it will be coming over to the US soon. I know Penticin, which is a repurposed medication, but it's a polysaccharide. So it also is awesome at binding the spike protein. It has been used as a prophylactic, as a nasal spray as well. And I will say one more thing. I really do like Ivermectin as a prophylactic. I really, really do. I mean, there are so many studies that have shown its efficacy and what it could do. And it's such a benign medication. The big study that came out of Brazil looking at 88,000 patients that dose the Ivermectin twice a week, every other week. And by the way, a lot of these patients were not even compliant, right, in doing it that way. But still, that cohort versus the control population that didn't take it did so much better when it came to morbidity, mortality, ICU stay, hospital stay, not even getting the virus to begin with.
So without nothing, so you use it every other week, you said?
Yeah, I do. I dose it at 0.2 milligrams per kilogram, So I'll do like Monday, Tuesday, and then skip a week. Monday, Tuesday. So it's like essentially you're doing like 4 pills a week. And again, I'm using it in the context of not by itself. Like that was the problem. Like everyone thought, like nothing's its own panacea. But in combination with using high, zinc, C, and D, and like taking care of my gut microbiome and all these, those other few things I mentioned, like I'm using it that way. Does that make sense? Sure. And then if I get sick, I do double the dose of it, double or triple the dose of it, and you want to take it with food. And then I take it with all those things I just mentioned, the amoxicillin and the medicinal, blah, 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 blah. So, and then as far as long COVID goes, many of the people do have these phages still, and do have the spike, obviously they're harboring the spike protein. So I'm using a similar thing to what I just described when you're acutely infected, right? But it's taken over a long period of time. And then we're mixing in a bunch of other things like different peptides and different supplements and things like that to support the mitochondria, support the gut, rebuilding and restoring health and balance of the gut microbiome, as well as really trying to mobilize spike protein and bring it out safely out of your body. Because I don't want to break the spike protein apart. I just want to make that clear. Because of those neurotoxic fibrils we were talking about, if you're breaking it apart, then you run the risk of maybe making it worse from a neuroinflammatory standpoint or a neurodegenerative down the road. So I don't use things that break the spike. We don't use that. We just want to mobilize the spike, bind it, and then poop it out.
It sounds almost like by itself a branch of medicine that it should be, because all these things that you're explaining, I don't think any normal doctor without going through this training would know what to do. They would do one or the other, maybe three of these things, but you're talking about a whole system, whether it's protective or healing.
That's right. And the problem is a lot of these modalities in the patients that have moderate to severe disease, these interventions don't work really that well either, because first of all, their gut microbiome is destroyed. They can't really assimilate or absorb things well. They can't eliminate things well. And they have to go on to more advanced treatments like IVs. And we use EBOO. We use a specific, we talked about that, a specific EBOO, because we've proven, and we're going to publish this, that the EBOO does indeed filter out the spike protein and the toxin-like peptides as well. It was always the school of thought that plasmapheresis is the only thing to do that, but depending on the EBOO device that you have and what you can do, you can also safely, and it's a very safe procedure done in the right, obviously with the right training and with the right patient. It's great. And it's another way we really move the needle with our sicker patients as well.
Robin, coming to the end of the program, I would like to ask you, what do you want people to pay attention on themselves, not the doctors, because you know how doctors work, but on themselves, like, oh, I'm experiencing this and it's not normal. So what are the, common symptoms? I'm not talking about having COVID. I'm talking about all the rest of the stuff that you're talking about.
What's really interesting is, Ezra, is a lot of people have come into my office and they have no idea what's wrong with them and why they've been like this and why they've gone to 1,000 different doctors. And what's so interesting and so simple is that no one has built a timeline with them. And once you're able to connect the dots and they're like, wow, that did happen. There is a temporal relationship between when I had the vaccine or I had COVID and these bizarre, crazy symptoms started, right? And so I want people to pay attention or go back, in time a little bit and be like, oh my God, that really bizarre autoimmune disease started after that, or this cancer that I got happened after this, or this cardiovascular disease developed after this. Obviously collective symptoms that we talk about along COVID all started, then. And then understanding that there could be a correlation is really important. And then, getting the right blood work and looking at the right biomarkers, we can test for these microclots too. And when you have the pattern and the constellation of all these things together in combination with the history, then you can really help these people and treat them properly, But it can be anything, Ezra. It can be any of these things, like your friends that had a stroke, that they were completely healthy and they don't really have any vascular disease, right? Like, why is that happening, Or this young person that had a heart attack. These people should be worked up. This should be in the differential. This should be in the differential diagnosis, and they should be worked up properly and make sure that this isn't driving their disease process to save them from this happening again or it evolving into something worse,
Yeah, I'm sure that people who are listening to you in other podcasts as well, I'm like thinking of myself like, oh, do I have any symptoms? I'm sure Dr. Yurt would find, because we did all type of testings.
Yes,
but
well, she's on top of it. You don't have to worry about that.
But how would people reach out to you? Where's your clinic? Is your Instagram alive? And are you informing people?
Yeah, I'm alive, Our clinic is terrainhealth.org. And we, do complimentary discovery calls and things like that with people. I have a team working with me. I have a wonderful nurse practitioner and a naturopathic doctor who are wonderful. And we all collaborate as a team as well. And we have like nutrition, counseling, health coaching, all that stuff to help people. And we have a big IV infusion center that utilizes all these modalities for even patients that are a lot sicker, right? Mm-hmm. My Instagram handle is Dr. Robin Rose. And then I think my Twitter is the same, and Facebook is just Dr. Robin Rose. So, you can follow me at any of those places. And I will say one more thing. We did build a platform for consumers to easily access the bundle, like the Spike Detox bundle. It's at Medicore, MEDI-Core, CORERX.com. So it's MedicoreRx.com. And so a lot of these things I was talking about live there, so people can get them.
Yeah, I checked it out, and we're going to put everything on the show notes. I mean, this conversation could go for 3 hours because it seems like it's affecting all parts of the body. But, our format is limited to about an hour. But, thank you so much. This is so important. This is more for doctors than consumers, actually, because they need to wake up and look like, how can I get more training around this? Because like you said, COVID is not going nowhere, and it's going to keep coming back. And
true. You're 100% right. And you're right. It is, doctors should be listening to this, but I hope that the regular patient person that was listening to this, got something out of it and can recognize or look for things or be more proactive.
Sure.
Right? In living in this world now that we're going to be exposed to this all the time.
Thank you so much.
Thanks, Esra.